Hi, good day, good evening, I'm Dai. I'm in the hospital now. I'm hospitalized due to the run-up of incurable disease called Dermatomyositis. After a month and a half treatment, I will be discharged from the hospital tomorrow. The content of this video is: from the onset of dermatomyositis, I have been in the hospital fighting. I will be introduced the contents over 2.5 months, so please take a look. I will send you a video of me taking a walk around the hospital where I'm currently admitted. I think it all started with a fun half marathon. During practice, I ran 20 km every day to build up my body and prepare for the actual competition. It's been a week since then, and normally my muscle pain should be gone. Or rather, it is getting even more painful. For now, I started taking painkillers that I had at home, It didn't work at all, so I went to an orthopedic surgeon and had the CT scan done. Doctor doesn't have any particular problems. He'll give me some strong painkillers as well. That's what he said. I thought it might be the flu, so I went to an internal medicine doctor, but they gave me antibiotics, which of course didn't work. Sleep time at this time was 1 hour. I was probably depressed. By the chance, I went to the same clinic where I had the blood test done last year, and I had the blood test done. Creatinine kinase, which indicated muscle damage, was 30,000 IU per liter. I was then taken by ambulance and admitted to the hospital. At this time, rhabdomyolysis was suspected. Since my CK level was high, I was started on fluids to flush it out with urine. In order to determine the cause, we decided to perform an MRI CT scan. However, a problem occurred here. Due to pain and depression, I was afraid of MRI and failed on my first try. The second time was performed using sedatives. On CT, I vomited due to an allergy to the contrast agent. It won't go smoothly. Based on the test result, polymyositis, dermatomyositis was suspected. There are various items that can be used to diagnose polymyositis, dermatomyositis. Here is a diagnostic criteria. If you are interested, please stop the video and check it out. We will introduce the pathological finding of myositis. In 5 electromyographic changes and 9 muscle biopsy. As shown in the diagram, insert the needle into your arm and observe the electrical waveform. This is really hard. And then muscle biopsy. This doesn't hurt as it uses anesthesia, but you don't want it to hurt. In this way, cut about 6 cm and remove 1 cm multiply 1 cm of muscle. since this disease is an autoimmune disease. I have to undergo a flurry of blood tests to find out which antibodies are involved. I haven't had any treatment, but it's been almost 2 weeks at this point. It hurts, my body feels heavy, and I can sleep. This was painful. Although the diagnosis was not confirmed, it was thought that dermatomyositis was likely. So we started administering immunoglobulin to lower the CK level. It is a medicine that regulates immunity infusion for 5 days. In my case, it was nausea, vomiting, headache, fever, chills, shivers, and fatigue. It's quite painful. However, thanks to this drug, my CK value has dropped to 16,000 micro per liter. Although it is far from the standard value. After getting through this treatment, the following happened. That is edema, especially my arms, which have swelled to twice their size. This may be due to muscle weakness. My weight had also increased by 7 kilograms. Even though I couldn't move my whole body. I became even more immobile and needed assistance with eating and showering. Performing this movement is as hard as running 100 meters all out. At this time, the hospital stay was 3 weeks. At this point, dermatomyositis is diagnosed and the next treatment begins. That is, this is steroid pulse therapy. The main treatment for this disease is steroids. However, steroids are fraught with side effects. Osteoporosis tends to occur during steroid pulse therapy, and as a countermeasure, I take osteoporosis drugs. During administration of the drug, bone resorption is suppressed, and by suppressing the outflow of calcium from bones, it is possible to obtain therapeutic effects for osteoporosis. However, since tooth and gum tissue also uses calcium as raw material, it becomes difficult to form new teeth and gums. Therefore, care must be taken when performing dental treatments, especially tooth extraction procedures while using these drugs. The gums are slow to heal after a tooth is extracted, and the bacteria can enter during this time, causing inflammation that spreads to the jaw, causing osteonecrosis of the jaw. If high doses of steroids are used, the immune system is weakened, so bacteria in the oral cavity cannot be removed. And if bacteria enter the jaw, osteonecrosis of the jaw may occur. So I had to have my wisdom teeth removed. Because they tend to have bacteria, 4 pieces on top and bottom. This is to reduce the risk of osteonecrosis of jaw, but since it is invasive, there is also risk of infection. The dentist was also hesitant, but decided to do it because the risk of osteonecrosis of the jaw was more frightening. It usually takes 1 month to extract 4 teeth, but it was done in 2 weeks. I need to finish the steroid before they took effect. Steroid pulse therapy was effective. At this time, I had been in the hospital for about months. At this time, the edema still persisted. After treatment, I transitioned to oral steroid. But during this time, I only slept for about 2 hours. It's a side effect. I awake for 22 hours, so the day doesn't go by at all. Meanwhile, something happened again to my body. It's a swallowing disorder. This is really scary. The edema gradually subsided, and I thought I was able to eat. But then I started having food stuck in my throat. If I try to swallow, food will end up in my windpipe. My symptoms worsened day by day, to the point where I could no longer swallow saliva. There were 2 things I was particularly scared of: sleeping at night. I thought I was going to die in my sleep. Another option is tooth extraction. I was scared that I might swallow saliva when I pull it out. But the wound did not stop bleeding, and healing was quite slow due to the effect of steroids. Somehow, the tooth extraction was completed. And the terror of the night never ends. Days when I can't sleep and want to do something. So I started swallow training with a speech therapist. The specific details are as attached. Anyway, I tried my best to get out of the hospital as soon as possible. My motivation is meet my wife and my son. As for my diet, I couldn't get the calories and protein I needed, so I lost weight. My swallowing function was still weak, so I couldn't chew or eat anything. But it took an hour and a half to finishing it. I ate it hoping it would make me feel better. I went to an otorhinolaryngologist to check my swallow level. It's like a swallowing level of an elderly person. In particular, fluid seems to accumulate in an area called the profound fossa. This appears to be due to muscle weakness here. Still, I worked hard at every meal, swallowing training, and eating training for 2 weeks, and little by little I improved. How many patients in the same room have I seen of? At this point, 2 months and 1 week had passed. Actually, at this time, my wife became depressed and decided to quit her job. She seemed to be distressed by having to balance worrying about me and raising children. This was also the time when I felt even more motivated to go home as soon as possible. My swallowing function has recovered by about 70%. And just when I thought things would get better, something new happened. It was ischemic colitis. While I was trying so hard to feed me regular food, I reverted back to liquid food. It has been decided that the hospitalization period will be extended by an additional 2 weeks. I'm anxious. However, there's nothing that can be done other than to work hard on swallowing training so that I can return to eating normally. At this time, my nutrition was too low. And also, I was given an intravenous drip. I felt like I was going to faint from hypoglycemia. The doctor almost never comes on my rounds. And even when I ask the nurse to change the prescription, she insists that the order is correct. I can be discharged from the hospital if I meet the following conditions and continue to attend clinic specializing in swallowing at the final swallowing test. It took 2.5 months from the onset of symptoms to hospitalization and discharge. When the disease was developed, when I cried and I wondered why this happened to me. With this experience, what is life for? How do I spend my limited life? My thinking has changed 100%. There seems to be no cure for this disease. Living with this disease, I am grateful for this disease because it taught me the meaning of life. I am currently hospitalized with a flare-up of this disease. Also, I will continue to live my life today with the things that I have learned and experienced from this disease. I would also like to thank my wife, children, and parents for supporting me through this situation. Thanks so much. In the next video, I will show you how I have progressed since being discharged from the hospital and how I'm living my life. Thank you for listening to my experience. See you in next video.